All right, so I've gathered my supplies. I've looked over my MAR, and there's an order from a provider to set up an IV for James Wilson. Let's see. So, going over my MAR and doing the six rights. So the right patient, right route, right medication, right dose, right time, and right documentation. So, I see he's allergic to NSAIDs, but none of these medications we are giving him are NSAIDs, and none of the medications interact with each other. So I have my medications right here. Okay. So I've also double checked to make sure that none of them are expired. So first of all, got to bring the garbage over here. Excuse me.
No worries.
So, now that I have my garbage, we will get the alcohol pad out. I'm drying up 5 milliliters of saline. This one first. I don't think I pushed enough air in. Getting all those little bubbles out. Okay. Let's see. So, dispose of this in the sharps container. Actually, I'm going to bring the sharps container over here. I'm keeping this out of my sight. Labeling my medication. Not covering up any numbers. Oops, the label's caught on the paper. There. Now, I'll write up my med. Also, I don't remember if I verbalized this, but I was doing my first med check. As I'm drawing up the meds, let's see, so hydromorphone. It is 7:30 in the morning on December 2nd. I'll put my initials. Oops, leave that there. Okay, so excuse me.
Are you trying to get the med label?
We are drawing up 1 milliliter. Getting a lot of air. Let's see. I don't know if this needle is on completely all the way. It's getting a lot of air in. Let me try something here. Ooh. There we go. Okay. Try that again. There we go. Okay, so now that we got 1 milliliter, going to and I will put my med label on it. Okay. There we go. Clean up my mess here. Okay. So now I did my second med check here, making sure that I have the right amount as well. Okay, so now that I did my second med check, we are ready to go in. Oh wait, I lied, we're gonna set up the pump first. Alright, so I'm gonna fill these things out. So it is 12-2-19 at 7:30 in the morning. Put my initials on there. All right, so I got my labels all made up. So now we are ready to move on. So I got my pump right here. Okay. sure my tubing isn't all tied up. Okay. So set that there. So I'll go on and spike the bag. Drip chamber. Pull this out. Flip it until Minnesota is filled, which it is. Whoops. Put in the cassette. Make sure there's no bubbles in my tubing. Just go back a little bit. Thanks. Okay. So almost got these bubbles out. Perfect. Okay, so now I'm going to hang that up there, making sure this doesn't touch anything. Okay, so now I'm ready to do my piggyback. There's the tube. Alright, so first things first, I'm going to put my rolling clamp on. I don't want my medication to spill out. Okay. Perfect. Ooh. Probably should have taken the cassette out to do that, but it's all good. So now since this is connected, I can unclamp this. Okay, so for A, let me grab my mar here. So this is the sodium chloride, so it says to run it at a rate of 100 milliliters per hour. The volume to be infused, it is a 500 milliliter bag, but just so we don't inject air into the patient after the bag is empty, just in case, if somewhere to leak out or something. I'll put it at $4.90, just to be on the safe side. So now program options, I'll set it to standby. Perfect. So under B, we'll set it to concurrent so we can put it in standby. Okay, so the rate is at 50 milliliters per hour. Volume to be infused is 50 milliliters. So now we can go set that to standby. Yes. Okay, so now that all these are in standby, we are ready to go to the patient's room. So I will gather my, oh wait, almost forgot to label my tubing. Okay, now we're ready to go to the patient's room. So let me gather all of my supplies one more time. Let's see, if I had some more needles. What happened to those? So I'm just gonna grab a few more needles just to be on the safe side. All right. Got the IV needles, my 2 meds. Just in case we need some Tegaderm. And my MAR. Okay, so now we'll enter the patient's room. Come in. Hi, my name is Chelsea and I will be your nurse today. Can I have you verify your name and date of birth?
James Wilkinson, May 12th, XX.
Oh, perfect. Let's see. I'm just gonna set myself down here. And then after I do hand hygiene, provide privacy, I'll check the patient's wristband. And I see you have an allergy to NSAIDs. Do you have any other allergies?
Nope.
Okay, sounds good. So what we'll be doing today is we'll be giving you an IV. So one of your medications in your IV will be sodium chloride. That was stuck on the thing. Sodium chloride is just a saline flush that'll help keep you hydrated. Then we also have levofloxacin. That's an antibiotic which will help fight off your infection with pneumonia. Then we also have hydromorphone. That'll just be an IV push. So that's just for your pain. And I know it was in the chart that your pain is at a 6. So what's your pain at now?
6.
Okay. So since it's greater than 4, we'll go ahead and administer that. All right. Excuse me. So, and I will do my 3rd med check once I get to the patient's bedside. So we're doing the 3rd med check. We're good. I'll keep that there. Let's see. Oops. Okay. Okay, I probably wouldn't use these since they were on the floor. So if I need more, I would grab more from the med cart. All right. Let's see. So now I will make sure or see if they have a preferred arm. I see it's the left arm now. So make sure that there's no inflammation, redness, or any of that on their arm. Okay, so first, I'm gonna prime my extension tubing with my saline. And since it was just opened, it doesn't need to be sterilized. It should already be sterile. Go ahead and push that. Oops. probably should have put on gloves for that. So let me do that now, just to be safe. Alright, so we got my gloves right here. Alright, so we have the primary tubing, or not the primary tubing, the extension set primed already. Now we'll take out this. There we go. Just gonna set that over here. Set this over here as well, so I got more room. Alright, so I'm just gonna put this tourniquet on your arm, so it'll just kind of constrict your arm and make it easier for me to find a vein. Lift your arm, please. Okay. That's it there. Alright. Excuse me.
You're good.
Okay. So now I'm gonna find a vein. Oops, I'm gonna put this a little bit higher. You lift your arm, please. Thank you. Alright, so I got a good vein right here. So I'm gonna take an alcohol swab. And then I would also put the tourniquet 4 to 6 inches above my insertion site. So now I'll let that dry. And then, sorry, hand hygiene. Still doing okay, Mr. Wilson?
Mm-hmm.
Perfect. Okay, now that I got my hand hygiene, take a few more gloves. Okay, so I'm going to put the tourniquet back on one more time. And I'll take my needle. Okay, Mr. Wilson, you'll just feel a slight poke. There we go. All right, ready? Feel a slight poke. 1, 2, 3. And okay, I didn't get in the vein, so let me try that again. Probably shouldn't have just placed them in separately. Okay. Excuse me. All right, sorry about that, Mr. Wilson. Grab some more gloves. Okay, we'll try to put the tourniquet, or we'll put the tourniquet on, try to find the vein again. Perfect. Excuse me. You want to come on this side?
Yeah.
Cool, thanks. In a circular motion. Take off the tourniquet, take off my gloves. Hand hygiene. Almost knocked that thing off the shelf. Alrighty. So we're going to try this again, Mr. Wilson.
Okay.
There. All right. Back up a little. So you'll feel a slight pinch. Ready? 1, 2, 3. I just realized the clamp was on for that. So let me pull that out. Okay, so that might be why we haven't been getting blood flow. So let's try this one more time. Okay, I apologize, Mr. Wilson.
It's okay.
Oh, forgot to find the vein first. Found the vein. Now we'll get another alcohol swab. Got the tourniquets. Hygiene. All right, let's try that again. Now that the clamp isn't on, we will all right, Mr. Wilson, one more time. We'll just feel a slight poke. Oh, there we go. So, where's my Tegaderm? Actually, apologize. Should have hooked up this before putting the Tegaderm on. Perfect. Okay. Being careful not to touch that. All right. So now, going to tape using the what's the name of it? I want to say crochet, but I know that's not right. Using that method, taping down that as well. Do one more piece of tape just to tape the tubing so it doesn't go all over and yank the IV out of the arm. All right. Okay. So now we are able to do our saline flush. And since I already have some saline in there, I will push the rest of the 2.5 milliliters. If I can get it out, there we go. Okay, so we're at 3 milliliters. Pushing this slowly. There we go. Make sure that doesn't go into the patient or touch the patient. Okay, so now we can go ahead and administer the hydromorphone since his pain is higher than 4. Probably should have the meds right here. Okay, so with the hydromorphone, we'll be pushing that at a rate of 2 to 3 minutes, very slowly. So I'm going to be pushing this in at a rate of 2 to 3 minutes, but since time is an issue for the Testout, and that was 2 to 3 minutes, but in real life it would actually be 2 to 3 minutes. Okay, so now since I administered the hydromorphone, also forgot to mention to aspirate to make sure that I'm in the vein still. Make sure it doesn't move on me. And we will administer the saline flush lastly, again at a rate of, or the same rate of the medication, so 2 to 3 minutes. After aspirating to make sure that the needle's still in the vein. So I pushed it in at a rate of 2 to 3 minutes. So now we are done with the saline push and we are able to move on with the IV. Or hook up the primary tubing, I should say. Okay. So, I'm not keeping that out of my sight. Set that on the table. Alright, so I will, excuse me, disinfect the port one more time. And we are ready to move on to hook up the primary tubing. If I can get that. Sorry, let me wipe it off one more time. 'Cause I think I touched it on accident. Perfect. So now I can go on and label the insertion site with my initials. I'll show you once I'm done. Okay. Initials, the date is 12/2/19. Gauge is 22 gauge, and I'll include the time. So 07:30. Just like that. Perfect. Okay, so I will go, whoops. I folded that over, but we're good. Alright, so go ahead and label that. And now we are ready. I'll make sure that my patient is doing okay before I start. Alright, so now we'll hit start all. And then we go ahead and start all, but since we're testing, I'm just gonna stop it, even though I would continue to start the IV and have it running. But just for Testout purposes, I'll stop that. Okay, so then I will make sure that my patient is doing okay. James, are you doing okay? Mr. Wilson? Okay, make sure that they tolerated the procedure well. Okay, so I'll be back in about 30 minutes just to check up on you and make sure that you're doing okay. I'd hand him the call light, and then I'd go off and document, also clean up this area before I leave. So I'd go ahead and document the time, date, initials, let's see, time, date, initials, the number of attempts, the location of the insertion site. I'd also indicate what his pain rating was before I administered that. So let's see, the location, how many times attempted, initials, date, gauge, time, and all the meds that I administered. And yeah.